is the reflections and wrap up of the HIV self-testing programs that CBRC and our various community partners have been running, which unfortunately have ended due to lack of funding. However, we really wanted to take the opportunity to talk a bit about like all our learnings and also the report. Was released just yesterday, our community report. And so it's available on cbrc.net. It's called Good Times Getting Pricked. Yeah. Um, so just to start, the Community-Based Research Center acknowledges the historic and ongoing impacts of colonialization on Indigenous peoples in Canada, including countless lives lost, as well as racist systems and institutions that continue to marginalize Indigenous peoples. We commit to decolonization and reconciliation as part of an essential part of equity and inclusion of queer, trans, two-spirit, and non-binary people. We acknowledge that we must continually and meaningfully to create space in which Indigenous peoples can thrive and feel safe. And I really do want to take a moment to acknowledge the work that the Two Spirit team has done, specifically in the Medicine Bundle project that's part of the HIV self-testing work. And really, I think is a great example of how the um, of what meaningful like reconciliation, and it's not like we've solved all the problems, but really actually starting to listen to Indigenous people and let them lead the work that they are doing for the community. So I think this is a just a really great example of what this actually means in practice. I do want to also just acknowledge various, I'll call them key partners. So the Public Health Agency of Canada, who provided funding, Reach Nexus, who provided the HIV self-test kits with funding through the Public Health Agency of Canada, Katie and Can, who supported the training, Grinder for Equality, that supported with the MyTest project, and almost 50 community partners who were involved in distributing HIV self-test kits. Um, we're also running this on HIV Testing Day, which is today, and so very exciting. And I'm so happy and proud to be able to introduce some of my co-presenters who will be talking about the work that they've done in their program. First, we have Ali, use she, her pronouns. So Ali is a passionate advocate for harm reduction and equitable policy, shaped by her own lived experience with systemic stigma, criminalization, and policy shortcomings. With over a decade of nursing experience, she has worked to integrate harm reduction principles into acute care, outpatient services, and broader health systems across Calgary and Alberta. Her work extends beyond clinical settings into grassroots activism. She has played a critical role in mental health crisis response and community-based harm reduction programs. As the founder of Street Cats YYC, a grassroots night outreach team, Ali leads efforts to advance health equity, promote social justice, deliver community education, and empower people who use drugs. Both professionally and personally, Ali continues to push for transformative change in healthcare and drug policy. Um, and then I also have Scott Allen, goes by they, them pronouns. Scott is a proud Cree, Ojibwa, and Métis Two-Spirit, originally from Peguis First Nation, Treaty 1 territory. They're dedicated sexual health advocate, educator, and community leader based in Prince Edward Island, Canada, and serve as the Atlantic Regional Director for the Board of Directors of Katie. As the Men's Sexual Health Program Coordinator at Peers Alliance, Scott focuses on advancing sexual health education and support for 2S LGBTQIA+ communities, particularly men who have sex with men. With a passion for inclusive, community-driven initiatives, they have led campaigns, workshops, and public art projects that promote STVBI prevention, destigmatize HIV/AIDS, and champion sexual health rights. Scott's work bridges community engagement, healthcare education, and public awareness through innovative programming, partnerships, and advocacy. Some of their recent projects include the creation of a community-led dried blood spot clinic, which provides accessible, stigma-free viral load counts for people living with HIV, testing for HIV, hepatitis C, and screening for syphilis. They also advocate to expand access to preventive measures like free PrEP, PEP, DoxyPEP throughout PEI. And I'll just read my own bio. So my name's Chris. I use he, him pronouns, and I am a nurse practitioner in Ontario. I'm a cis white gay settler from Treaty 13 to Toronto, the traditional territories of the Wendat, Anishinaabeg, Haudenosaunee, Métis, and Mississaugas of the New Credit First Nation. I've been heavily engaged in HIV self-test rollout amongst 2S LGBTQ plus people in Canada. My clinical experience includes sexual health, gender-affirming care, substance use care, mental health, and primary care with 2S LGBTQ plus people, as well as people who are homeless or living in shelters. Um, so I did want to look back really briefly, going back to the HIV testing day. Um, about 4 years ago, we released a video about the HIV self-test with Travis Lanaff, who was on Canada's Drag Race season one. So I just want to play the video.
When I was in sex ed, I remember them making it HIV was a gay thing, and that you probably would get it if you were gay. When a nurse would bring back my negative test, they'd be like, "Congratulations," or "Don't worry, you're HIV negative." So that every time you go for a test, and you're like freaked out at this other result. And then when I was positive, I mean, that was not the response that I got. This is an HIV at home self test kit available in Canada. How does it work? Let's find out. It's important for me to show my HIV test today because that is such a big moment. Sharing my positive test with people. There we go. Now it's time to put on your band aid. Typically, in media and at a doctor's office, we always aspire to a negative test result and grab bottle number 3. So it'll be interesting probably for people to once see the 2 dots versus the 1. I think I know what I'm going to get. She's positive, HIV positive. After you test positive, you have some knowledge. So knowledge is power. And you can start to make some informed decisions at your own pace on how you want to tackle your new HIV status. We're all part of the same community, so like let's support our sisters, including our pos ones. And one way that you can do that is learn a little bit more about it and fight the stigma yourself.
Yeah, so I just wanted to share that just because it was kind of part of the initial push for us to do something different in terms of how we wanted to roll out the HIV self-test compared to how other oh, sorry, compared to how other programs and initiatives had been run before. And really, we'll get into that in just a moment, but just a little bit of background. So the HIV self-test was approved in Canada on November 2020. It was actually the same day as the presidential election results. I think it was November 4th. So it got a little overshadowed at that time. And now, since then, it's actually been integrated into part of the Public Health Agency of Canada. So that's what PX stands for, and the World Health Organization, so WHO, into their HIV testing strategy. However, it has been available in many other countries as early as the 2010s, not necessarily this specific type of HIV self-test. And what we're talking about today, really, what we're focusing on is this short-term funding for distribution that was provided by PHAC in 2022 and ended in 2024. So this is really that's really the focus of like what we're talking about today. I just wanted to talk about what our like goals and approach were. So really at a high level it was to enhance HIV testing, or access to HIV testing rather, and reach diverse 2S LGBTQIA plus communities in this work. So we really thought about what the various approaches, and so we went with multiple approaches. So we had, and we'll get into what the details are, but we had mailed options, we had in-person options, we had Indigenous led options as well too. And within here as well too, we it was all community led. And so whether that was from people at CBRC that were focusing on it, or whether it was the various organizations that we were working with across the country. And some of them had have very specific focuses. Some of them have geographic focuses. Some of them focus more on like harm reduction. Some of them are ethno-racial focus. So like there's a large Black focused community organization in Ontario that we worked with. So really, it was kind of varied and it really was looking at who's meeting the needs of the community. Um, Throughout each of them, we went as low barrier as possible. And also, really, we wanted to ensure that we were providing more than one HIV self-test. We didn't want to be stingy, basically. And really, it was how can we get more testing out there, and it's really around like errors in testing. As you could even see in the video, it's a little complicated. Things spilled in our video, etc. We also wanted to encourage retesting and also sharing with partners and friends. Um, so as I mentioned, there's the report. So good times getting pricked. It goes into more detail than I'm going to go into today, and really is just our community report. It's available in English and French. There is some data within there. We do have a bit more that we have so much we didn't weren't able to share everything. So if anyone really wants more details, more than happy to have them reach out to CBRC directly. Just info@cbrc.net is probably the best way to do it, and we can chat about what might be helpful and beneficial for you. Now I just wanted to get into like the specific programs. So we had mailed programs. So it started with Test at Home, and then the My Test, which was focused specifically on people who were accessing it through Grindr. Um, Functionally, these were the same programs. It asked the same questions. It followed the same process. It was really more just how people were funneled into it. And really, what we did is we provided up to 4 HIV self-tests that were mailed for free, along with various pieces of like information from Katie, like brochures, things like that. We had a tips and tricks handbook, which I'll show briefly as well. That really helped like guide people through some of the like challenges in doing the test. We had wraparound support in the HIV self-test buddies as well. So it was a group of 2S LGBTQIA plus peers who helped people in English or French to be able to make sure that they had questions answered, could get referrals, things like that. And one of the things that really I want to focus on too is in the way that we collected demographic data, we didn't ask for anything until after someone had ordered the test. So it really was a like, let's get the tests out and we'll collect data as kind of a secondary piece to it. We still had more than 80% of people fill out all the information. So like I think it was a very successful approach and it was like gentler, kinder. Yeah, I think that that's one thing that we really like learned from that. We had various in-person programs as well. And so, like I mentioned, we had multiple community partners, almost 50 of them. And so this was through this Test Now program where we basically gave them HIV self-tests and helped them develop a program. They received micro grants for it. Usually it was in the range of like five to $10,000. Maybe a little bit less if it was like a very small organization and they really only were distributing a little bit. And so really with this, it let them. There was very little like restrictions on what they could do. So really, it was like, well, what's the need of your community? What do you already offer? How can we integrate that into the various things that we're doing? And Scott and Ali will be able to talk a bit about what their experience with that is and some of their programs, just to highlight that. We also did a test now at Pride, where we distributed HIV self-test kits through Pride festivals when we were going for the Sex Now distribution in 2022, three, maybe no, Our Health in 2023 that we did this. Um, and in both of these cases, we really didn't collect as much information about like the demographics of people, was we really want to focus on like low barriers. So it was like do you need an HIV self-test? Great, let's get this to you. If we can collect a little bit of data so we can know who we're reaching, then great. Otherwise, that's okay. Like, that's not the primary importance. The primary importance is actually getting the access to HIV testing. And then lastly, but not leastly, we had a Two-Spirit and Indigenous program. And so this is the medicine bundle, which has gone through multiple iterations from a research study to a program. And now it's back into a research study slash program. I know that the team is going to be providing some more information on this from the CBRC website. So I would look out for it. Um, what you see here is a medicine bundle, and really it is indigenous medicines combined with HIV self-test and other sexual health resources. And so this was how the community and the Two Spirit program wanted to create their program. And it's one of the most successful programs that I think we've ever done at CBRC. So I really want to just provide like kudos to the team and the like community for creating this. And I'll get a little bit more into some of the details on actual distribution in a moment. Just to kind of like go over like the community support in a little bit more detail. So that we had this tips and tricks for HIV self-testing pamphlet, follow-up evaluation survey that was available by a QR code. And we also sent it by email to folks who signed up online. The peer support. One thing I forgot to mention is this like sticker. So, one of the main challenges about testing for HIV with this Insta self-test is it needs to be in this 15 to 30 range, really 15 to 25 range. So we made sure that like we were distributing in person or like sending in the winter or the summer that people like actually tested inside in a temperature controlled environment so that it wouldn't give like false positives, things like that, which unfortunately has happened in the past. And then in terms of the community partner support, I believe I went through all of this, just seeing if there's anything else. I think the main thing I forgot to mention was just this like training, this specifically the training that we provided. So we had, I believe, three different courses that were offered to our community partners to help them understand a bit more about the HIV self-test and help them kind of design the program, as well as like personalized support with our team, usually Kirk and Spencer, who are the program managers for the Atlantic and the Prairies. Um, and here's just some like examples of the advertisements that we had. I just love the graphics so much, so I just had to throw it into here. But yeah, like in terms of like, okay, so we created all this, but like, what did we actually achieve with this? So we reached 30,000 people and we distributed 71,000 HIV self-test kits nationally. So, this is like one thing that like high level, this is like quite amazing in terms of like a community organization and a group of community organizations being able to do this. I know it is a bit of a drop in the bucket in terms of overall HIV testing, but um, the funding that we were provided was like also quite limited as well too. And I think that this, we community organizations make miracles out of like tiny budgets all the time. And so really this is something I think we can all be extremely proud of. Looking a bit at the actual like overall program, these are some of the like where the numbers kind of like landed. And then as you can see kind of in the fourth column with test now, this is the like in-person distribution. It accounted for half of the actual distribution that we did. And so really it was an amazing opportunity to get it directly into people who might not access things online or already have like existing relationships with the various community organizations. And then we had, as you can see, also from Test at Home, this was like our mailed option, and this was primarily through like social media, distributing it, like information about how to sign up for it, newsletter, things like that, word of mouth, which we did quite well with. My test was probably the most like I'll call it efficient, because we did a blast on Grindr. once every 2 to 3 weeks on a Thursday. And it popped up on the actual like app for people who might be interested. And as you can see, we were able to distribute quite a bit through that program. Um, it does reach also people who are accessing Grinder only, so like there are like downsides to it, but it was quite effective at reaching folks who would be accessing that specific app. And then just kind of back to the in-person stuff. So Test Now at Pride, it was again quite efficient. We're just handing it out, so really it was not like not a lot. It just a lot of like logistics on the back end mostly. And then for the medicine bundle, while the numbers might not look as large, this is quite a large amount. It also takes, there's a lot of like love and care that goes into the creation of the medicine bundle. And so these are, but it is, and it's also representing, a smaller like subsection of like the population, like Indigenous folks specifically. So, I think this is like an amazing result for the medicine bundle in particular. So now that I've talked a bit about this at a high level, I did want to pass it over to first to Ali and then to Scott, just to talk a bit about their program.
All right. So we're a walking night harm reduction outreach team. So we usually prep around 7:30. We get out into the street around 9, depending on the day or night. So because we don't have like this similar structure to most organizations of like walk in a space to maybe sit down and chat, that posed a lot of barriers and just an ability to distribute the information in like a more comfortable way, I guess. So what we did to try and make that a bit smoother of a process is we started telling people that we were going to be involved in this project. We were getting these kits. We were really excited. We started pushing just some information around why this is cool that we have this and why we can be doing this just like in the night on the street, essentially. I know we wanted to be mindful of weather. And so, like in the winter, we wouldn't be bringing them out on outreach. Or when it got to like plus 40. But when we have some tepid evenings, it's all right. And we did do a lot of explaining around the temperature of the kits that we wanted to ensure like people were using maybe like a mall bathroom or something like that if it was a bit colder out and that's what they had when they had their kits at that time. Um, we also had to do a lot of like strategic planning around like our carts, our backpacks, how we were going to even carry the supplies. I mean, they are a nice compacted kit, but when you have a backpack and a little cart, it even like just having a few of them, they do build up pretty quickly. And then we also wanted to have pamphlets and like some information because it's so casual of distribution and it can be anonymous. It was a bit challenging to get some of like the data and the information, which we didn't want to push too hard because there is so much stigma in within our community. We didn't want to deter things to the other way. So we were trying to be really like vague. Like we try and like at least keep count of how many kits we handed out for the night, and like what area of the city we were in so we could get a bit of an idea. But folks that we're usually seeing in the night don't have housing. So they travel throughout the city. So essentially it's just like the city anyway. Um, we did move into, we do a lot of like punk shows. We do a lot of queer events, a lot of dance parties, just different events around the city that people want harm reduction supplies at and supports, which is really cool. It's kind of how we fund our organization. So we make makeshift DIY merch and then we sell it, and that brings us enough money to do our food and stuff. So this project also was really helpful because it could help us maintain some stacks and things like that to further engagement with folks. Um, in our night events, though, when we're doing tables, we had like people were so excited and they would take multiple kids for their friends or family. We were really encouraging people to take like as many as they wanted, share with your friends, whatever, if you want to do this in private. However, we had some groups of folks who were telling us that they had taken a bunch of kits and then they invited a few friends over and they all did it together. They all wanted to practice and learn how to do it so then they could help their other friends or people because it is a bit cumbersome, all of the little bottles. But like it's just incredible to have like something so accessible, even if it comes with like still so much stigma or so much fear or things like that. Um, we did also, we would do once a month a brunch, like a breakfast table in a park. So that created a little bit of a space and time so we could have a bit more conversations, a bit more support around folks who there's still just a lot of misinformation around HIV. And I think that is probably the biggest barrier that we had. And I found that within when we were doing events around like the queer events in the night with Pansy Club, there folks just knew a lot more. A lot of them knew that the kits already existed and they were really stoked. And there was much more buy-in, much more conversations um, in the night with folks who are using substances that are unhoused. There's a lot of stigma and I tried really hard to like we've built really good relationships with folks, so we've tried to like take that time. We spend just brief little conversations, just kind of like sprinkling little bits of information slowly, just to try and build that up. We're lucky enough that we have like a pre-existing relationship of trust with most of the community in the downtown. So that helped a lot in being able to sprinkle in those little things. Um, there was actually a really cool moment. Somebody I had been working with and trying to support at my paid job and at my volunteer position. He really wanted to get testing. It, he really wanted to go through that process, but was terrified and had never had any type of testing done before. Um, and we had been working on this for months prior to these kits coming. Once I found out we were getting the kits, we did have a conversation, and I told him we talked about like how afraid he was of finding out his status, of just like there's so much stigma, so much shame, so much just I hate society. Anyway, I mean I love it, Susan, but um, this opened up a really cool thing for him, and he was able to we did a practice run of a test kit once they came together, which neither of us tested anything. We just went through the motion of it, um, which I think created a lot of comfort because he wanted to do it alone. And that was fair. I set up a bit of a safety plan because I knew this was a really heavy thing for him. Um, and we had a plan to touch base and how we were going to follow up with whatever the results were. Most people, it was a lot more hands off because it is like an anonymous thing, but this was just a really cool tool to open up that space where somebody could find out something, make a decision, create a plan for themselves. It really empowers people and it puts that power back. And maybe you do nothing with that information. I mean, I don't want that, but like you have that information now and you can make those choices for yourself. But also, maybe that means like we're just ensuring like no rigs get shared. And like, I mean, we always want people to never share rigs, but maybe more diligence around that. Like, like there are just little things that make huge impacts. And like once we have that information, how are we able to slowly get the supports that we need and then come to terms with the fact that we want to start learning about stuff. And we talked a lot about U equals U. We did a lot of education around that and medication, different. We, our team also made a little cute pamphlet with our silly little, like, I don't know what kind of graphics we call our pages, but we made a little graphic sheet of just the local services that are here and the ones that are least barrier and the ones like depending on individuals, kind of what support services we wanted to try and gear them towards that we found are the most supportive. Um, but yeah, that it was just like a really cool thing that I think we never would have gotten it without these kids. And like I know it's like a huge, like, we want everybody to have a kit, we want everybody to be tested, but having the ability to support one person getting to a point of trusting their own self, their own reaction, and having that power over their own lives and regaining that autonomy and maintaining that privacy. Because we know like people are incredibly harmed by the healthcare system, and we've we haven't done enough work within the system to be truly all around, all encompassing, supportive, and kind to people. And yeah, it was just a really great thing. Something we did have some struggles with as well is folks with access to phones and internet. So we would do a lot of like the videos showing just on like our own cell phones, um, and like the QR codes and stuff. We would do all of the things, and so I think that made our data collection quite a bit lower than we would have liked because you remove a lot of that anonymity when I'm having to do the form for you or support you in it. Not that I would see it after, so I could hand them my phone and not look at anything, and that was okay. But it definitely changes that dynamic, I think, of feeling comfortably anonymous. Yeah, but I can pass it back to you, Chris, or to
Yeah, no,
Scott.
thank you so much for sharing that. I think like it's really, we talk about such broad things, but like one person, it's one person, like, we have to do this like one person at a time, really. And, it reminds me, and I'm like thinking back to, when like, I haven't mentioned this yet, but it's like, we have like, let's call it 10%, a little bit more than 10% of people who are living with HIV who are unaware of their status. There's obviously something about the way that we've been reaching people and providing services that's not working for that 10%. So like, and it's not going to be as like, it's going to be messy, it's going to be challenging, it's not going to be as easy and as like cheap or like efficient to be able to reach those folks. It takes like a caring human, and this is like a tool. That's one of the reflections we'll talk a little bit later. But yeah, thank you so much for sharing all of that. Um, I do want to pass it to Scott, um, just so you can share some of your thoughts and reflections.
Awesome. Thanks, Chris. I want to say a big thank you to you and CBRC for all the support through this project. It's been really great, and having me to come and talk about this. I do want to note that I am on the historical territory of the Mi'kmaq peoples. It's covered by peace and friendship treaties, and the indigenous people of this land have never surrendered their rights to lands or resources they traditionally used for. Something I always like to mention, especially with Epiquit and PEI. It's a pretty unique space. So, coming to you from Epiquit, really excited to be talking about this. So, bit of context. So, over 2 to 3 years, Peers Alliance was really successful in PEI. We were able to distribute over 1,500 HIV self-test kits across the entire island. And with a population of about, 2,500 plus queer individuals, out queer individuals, we thought that was quite a successful distribution. Our methods were quite successful in that sense. These efforts were rooted in community need, especially in rural areas where stigma, privacy concerns, limited access can be significant barriers to testing. Um, so a bit about, before I get into exactly how I distributed the kits, I want to be really clear about what was part of this. So I intentionally didn't just hand out a test kit and walk away. Each HIV self-test was packaged as a part of a care kit designed to support someone regardless of the result that they would get. The kits, oh my goodness, the kits typically included 2 HIV self-test kits, the detailed how-to instructions that CBRC provided, plus the sticker for the test buddies. It also included some safer sex and harm reduction supplies. So we provided condoms, lube, a safer snorting kit, also drug testing strips, and card to how to access our drug checking services here at Peers Alliance. I also created 2 trifolds that were included in the kit. One was on pathways to care for people living with HIV and PEI, and another was on pathways to care for STDBI treatment and PEI. Additionally, there was mental health access point cards. So including the Test Buddy stickers that were on each kit, we also had cards for our landing place, which is a wonderful organization running here in PEI. It's free mental health care for all 2S LGBTQI plus individuals. So they had direct access to that. They also had the addictions and mental health hotline card, so they could call that immediately if they were needing assistance. And then also information on where the mental health walk-in clinics were in RN and PEI that they could visit if they needed to as well. And then we also added in a lot of relevant CATIE resources because they had a lot of, CATIE has a lot of phenomenal resources, and we found this a great distribution method for those resources as well, and just went hand in hand. So we are also worked really closely with PEI's Chief Public Health Office to ensure transparency and accountability. We received like full approval for both our distribution methods and content in those packages with the CPHO, which was really nice to see them support this initiative. We were really intentional about minimizing harm and acknowledging that false positives can and do happen with these kits, and ensuring that there was a clear mental health and clinical follow-up pathway in place for false positives and positives in general. So of the 1,500 plus kits that we distributed, 10 false positives were reported. Each of those individuals were connected to our landing place or another specific mental health care, and also relevant clinical care as well, just so we made sure that they were taken care of. We framed every false positive as a touch point for care, a moment to offer peer support and reconnect someone to the healthcare systems that really often alienate them here in PEI when it can be a rural setting pretty much anywhere you go. So into our distribution strategies, I took kind of a multifaceted approach to this. I really liked the passive techniques, HIV self. So we did public events, MSM focused events, and through the I'm Ready program, we also distributed HIV self-test kits. And then we were able to curate targeted events for the 2S LGBTQI plus community with some funding support from the CBRC. Those looked like dinners and drag shows, burlesque shows, variety shows we were able to put on. We also did dinners at our community outreach center with a locum present, which was we found really beneficial to really reaching that small portion of people that were having trouble reaching. And then I also run out of my office a dry blood spot testing clinic twice a month, where it's targeted towards the queer community members, our queer community members, and in the DBS testing, they had a choice of doing the HIV self-test, doing the DBS test, or doing both with me with some peer support right there. We went about kind of doing a passive distribution. So even at these events, instead of having a table, people would have to come up to me and ask for a kit. We basically stood at the exit and handed out these kits to everyone that left. So everyone that came to the event left with a kit as well. And we found that really helped destigmatize needing to get tested and testing yourself. And it really got those test kits out there to the community where they're able to share them with their friends if they didn't want to do it, or they're able to do it with their friends that night if they wanted some support right there and then. These kits really reduce the burden on our overextended healthcare system here in PEI. I know that's not a local problem. It's all across Canada. Our healthcare system is struggling. So this really helped cut down on that. And it offered real autonomy to individuals in communities where privacy is quite a luxury here in PEI. It's quite often your nurse could be your mom's best friend, or there's that one person difference in PEI. We're quite a small little province. So in rural provinces like PEI, the maternal model of medicine where physicians assume they know what's best for you can be deeply alienating to a lot of our queer community members and trans community members for that matter. So this really helped decentralize, create a low barrier testing option for these individuals that could be really dignity affirming and quite possibly life-saving in some instances. As NGOs, I firmly believe we can't become the gatekeepers. We're here to break down those barriers, not replicate them. We're here to make sure that our community members have access points that they can reach and feel comfortable going to be able to access these kits. And I really take that to heart. And I want to be sure that with these kits, they were set up for success, regardless of their test. but I wanted to make sure that they were accessible to them as well. So the other options in PEI are pretty limited to be able to get tested with HIV. You either have to wait in the ER for about 10 hours to get a test. You can try and access at the time the two sexual health clinics in PEI that were localized into the two big city centers that we have, and I use big loosely here. And luckily they've announced a third location for the other end of the island, but at the time we didn't have that option. Or they could simply just not get tested at all, and that's the opposite of what we want to happen. So we had to really take a step back and have trust in our community members, provide them with the tools, and take it, like I said, take a step back to let people take control of their own health here. Um, it's it's really hard in PEI, really interesting in PEI when it comes to navigating healthcare systems and what's available, and what can be viable for our community members. We had overwhelming positive feedback from our community members. They appreciated the discreet, affirming, and empowering nature of the kits. Um, this model obviously isn't perfect, but it's working. I believe it's a really good blueprint for PEI and for some rural areas that you can scale up to some underserved areas across the country. And luckily, our Chief Public Health Office has seen the benefit in this distribution model, and they're actually purchasing HIV self-test kits for myself to distribute to the community now as well after the funding from PHAC has ended. That's kind of everything I did in a nutshell. Yeah, they'll pass it off back to you, Chris.
Awesome. Thanks so much, Scott and Ali. Like, I think it really is, so amazing to hear like all these individual successes that have come through this like funding. And I know it has been time limited and still imperfect, but I think it shows that community organizations know what they're doing and can actually reach the people that need to be reached. So in the way that they want to. So, this, I think we really have to focus on this as we think about the future. I'm just going to go through a few more slides and then open it up for any like question discussion. Um, but some of the key findings. So, and this is collected from our uh, mailed uh, uh, programs. So more than 1/3 of people who would access the HIV self-test had not tested for HIV in the past year, which is the minimum recommendation for men who have sex with men, and people who are sexually active. And then about 1/6, so like 14% had never tested for HIV before. So, our community does actually have higher rates of HIV testing than the general population. But 14%, if you think about that, it really is, we were reaching people who had not had good access. In terms of the satisfaction with the program, this is the thing I'll just take a moment to gloat. Very like proud of. 95% were very satisfied or satisfied, and I think it was like 87% were very satisfied when they reported on it. And like, how many programs that are like run by the government have that level of satisfaction? Like, let's just be honest. So, like, I think this like really shows how important it is for and like how we were able to take some of these like approaches and actually deliver on it. And so like walk the walk, not just talk the talk, right? So that's something I'm like really proud of personally. And in terms of the actual like test itself, it's finicky. There's challenges with it. It's the only thing that's available, but about 80% of people said they were very likely to use an HIV self-test again. So I think that there is, while there are challenges with it, like I think that if anyone in the province is listening at any point in the future, if you can find a way to fund this and put this into the existing HIV testing programs that you have available, it will reach people who are not being tested. And so if you're thinking about efficiency, if you're thinking about like getting to people who won't use the system or have barriers, etc., this is one of the ways. So I really would encourage you to think about that. Also, one of our objectives was to make sure that we were able to share HIV self-test kits, have people give it to their friends, family members, partners, etc. And so about 36% people said that they shared HIV self-test kits. So, I think that really just shows like that these like peer-led options. We don't have to gatekeep through a physician, nurse practitioner, nurse, community organization, even we can get it to folks and they can distribute as well. So it really just shows how our community cares for each other and can actually build each other up. There is a bit more data in the report on like province, ethnicity, gender, sexuality, but I'm not going to go through that in like detail. Like I mentioned, it is in the report, which is available on the website right now. So feel free to take a look at that. And also, if there's any other information that would be helpful for you to have, feel free to provide that, like contact us about that. In terms of like, we did a variety of evaluation. So this is like qualitative, where we did some discussion with community members. We had other organizations. Actually, Scott did some as well too. So this is kind of like some of the like high level things that really worked well. People appreciated the multi-pronged distribution strategies. I think that whenever we run something online only, we hear about the people that can't access it that way. Whenever we do it the other way, we hear like, so I think it's like, let's do both if we can do both at all times. And so they really appreciated that. And they really appreciated that like there was the like it was very seamless into getting an HIV self-test kit into their hand. And most organizations, it was like they show up, they receive one. If they don't want to talk, if they don't want to do anything, they can just take one and go. Um, or the ordering, they put in their address and their name, how many they want, and that's it. So like it's very, very like low barrier. Also, this kind of like peer and cultural framing. So, the peer-led component was very popular. And also that, as I've mentioned before, in terms of like cultural framing, so we had organizations like Black Cap and the Black Gay Men's Network in Ontario who distributed a significant amount to African, Caribbean, and Black people across Ontario, mostly based out of like Toronto, but it was because that's where Black Cap is located, but really like in many other areas as well too, and also the medicine bundle, which is Indigenous and Two-Spirit focused. Similarly, like kind of this simple stigma-free ordering, like you don't have to answer 30 questions about like who you I was about to say something, but who you've slept with, and like what you've done. It's just like, do you need one? Yes or no? Okay, great. Like that's all that was asked. And there's kind of wraparound support that I think that like Scott and Ali really have like talked about, so important. People really appreciated that. And I have to give again so much credit to our community partners who have really, 50% of the distribution came from our community partners. And so really this was like how we were able to actually be like successful. So that's again, can't give enough credit to them. In terms of what could be improved, some people had some issues with the like shipping. I think the interesting part is something like 98% of people received their shipping. I think maybe even 99% without any issues. So there were like minor challenges. I think people were a little concerned about like temperature, like being left in the cold, being left in the heat, things like that. So overall, like it was a like maybe more of a concern than like a actual like barrier. And like I'll just say like we used Canada Post in the past when we'd used I won't say which company because I don't remember, but like FedEx, UPS, something like that. Like 50% of the things came back and weren't available, like didn't actually reach the like person. So Canada Post was like by far the most simple, in my opinion. People wanted like clear instructions, diverse resource formats. So there was like we provided as much as possible. I'll say that the invalid rate was like 30% when we did it as a research study, and it was closer to 10% in the program. So people like learned a bit because they'd already done it before in some cases, but there was also like better instructions, more available. But people wanted more. So I think that really it's like thinking about like where are the like pressure points and pain points and trying to figure out how we can provide as much support as possible. People wanted additional supplies. So I mean, when we were mailing stuff out, we weren't able to provide that. The medicine bundle did provide that. Many community organizations provided like harm reduction supplies, condoms, etc. Like that. So, if it can be built into the actual programs, that's ideal. We did this in English, French, and Spanish. People wanted additional languages available, which I think is always important. Mandarin and Punjabi were two that came up most often. I think really looking at like what your population is in terms of like what language do they speak, who you're trying to reach. So really building that into anything you create. There was wanting to be a broader sexual health scope than just HIV. People wanted self-tests for every other infection available, which is not available, unfortunately. So, sorry. I would encourage manufacturers to think about this. People really like the self-test concept. And I'll also just say, like, if we could get additional HIV self-tests, there's um, it, it is a bit challenging to do. Pricking yourself can be hard. There's like the oral test. I'd love for that to actually be available. And then sustainable funding. I mean, I think we heard from both our community partners, and I'll just say like, yeah, like it would have been nice to have like not one-time funding, like you ramp up and then all of a sudden it's like, okay, money cut off. Like, great job, great program, and so like, yeah, where do you go from here? But yeah, so I just want to take one last moment. Here are the list of community partners. I won't read them all, but as you can see, there's so many people that were involved. And yeah, I just kind of want to ask any final thoughts, questions, reflections. More than happy to take questions at this point. I can go a little bit past noon if needed.
There was one compliment. They're very moved by what Streets and peers have done. Beautiful work. No questions, just a compliment.
Yeah, I was messaging in there when Scott was presenting. I'm like, this is amazing.
Well, if there's no questions, that's completely fair.
There was there was one question what PX Canada means, which I'm not sure.
I don't remember saying PX Canada. I'm just trying to remember what I might have been trying to communicate there. Maybe, yeah, I thought it might have been PHAC, and maybe I just said it quickly.
It's
Yeah.
possible.
If yeah. Okay. Well, I mean, if there's no questions, I'm more than happy to end the recording. Just maybe one last, I'll do a shout out. We are doing we're not doing a version of Sex Now this year. We're doing something called Our Bodies, Our Health, which is available online as well as at various Pride festivals. I will be actually participating in the Toronto uh, distribution of this. The one plug I really want to say is that like the work that like the data that's collected through these research projects is how we were able to get funding like this from PHAC. So we collected information on HIV self-test kits and what people liked, what people didn't like, what they wanted, who hasn't been tested, things like that. So I really would encourage you to participate in this current iteration of our research, and encourage members of your community as well too. It's available on the CBRC website. And yeah, I think I guess like Scott or Ellie, anything that you wanted to say as like a last thought or reflection?
Just thank you to CBRC. You made the grants and the funding really easy and able for me to be like mobilize and tailor the outreach events. And I really appreciate that from CBRC because we don't always have those, excuse me, opportunities to be able to like really mold the program into something that's going to be accessible for community members. So big shout out to CBRC, you, Chris, and everyone who did a lot of work behind this. It was really impactful.
Yeah, I want to echo that. Like, I mean, we're like real rogue grassroots. Like, like we're not somebody who can access any supports usually from most places, or any government thing. So it was really cool to be able to take part in something that our team has built like a really unique relationship of like going into places where most people can't. And it was just cool to like, I guess, be asked to be a part of that, and thank you. Like it's incredible. And I really, really hope that it's reconsidered for the funding and that this becomes just like a regular staple. It's in every clinic. You walk in, there's a rack of them sitting there. You grab one if you want it. Like that is the kind of response that we need and have needed.
Well, thank you to both. It's always great to hear um, the that like the intention that we have actually like is felt by like our community partners in terms of making things easy. But yeah, maybe I'll just leave it there. On the yeah, we need more ways for people to access HIV testing, and the work is not done. And thank you everyone for your part in this as well too.